Hello, everyone. I'm Dr. Foojan Zeine, psychotherapist, and I'm excited today to talk to Dr. Arjang Naim, who's an OBGYN, about PMS, premenstrual syndrome, which I think that every single female have probably at one point in their life have experienced it and dislike it. And it really affects your mood and probably your relationship with everyone around you. So hello, Dr. Naim.
Dr. Zeine, good to see you. Thank you for talking to me today. PMS is a very common problem. We've seen a lot of patients come to my office and have this complaint. Usually it's mood swing. It's usually due to the change of hormones in the body during the menstrual cycle. But I should tell you that I've been told not to tell a person, a partner, that, are you mad because of PMS, or are you screaming because of PMS, or are you, because then this is not a good thing to say. So you don't want to say that, but it is a very common problem. And as a physician, I will talk to my patient about this and what we can do about it. Some of them need to see usually a therapist, a psychologist or psychotherapist to help with that. Me as an OBGYN, I might try to help them with some hormonal treatment. What is on the market, something is called Sarafem, is a medicine that is actually an antidepressant, a low dose, who is being marketed for treatment for this. I usually don't like to prescribe it. I see that most of my patients, if you can adjust their cycle, it might be better. What I mean is that if somebody is not trying to get pregnant and is preferable to go on some kind of birth control, we can help them with those things. For example, we have something called the IUD, which is the birth control inside the uterus, intuition device, which is hormonal. And by going on this treatment, they don't have a cycle regularly. And a lot of patients see that they don't have that cycle of stress, anxiety, or mood swing. Or even there are some kind of birth control that we can put them on, that they have a period every 3 months. It's called seasonic, or I can adjust other kind of birth control. And this way they have the cycle every 3 months and have less anxiety. But for people who don't want to go on medicine, a lot of them they should see somebody like a therapist. Can you tell us, maybe you can tell us how would you recommend to treat these patients in that regard?
Well, the first thing is that there's a lot of problem that happens when the person are not aware of their mood swings and their behavior relating to their hormonal issue. I've had many people who are almost on the verge of the divorce before I told them, can you please do a mood log for me? And after they did a couple of months of mood log, we saw that exactly at the same time every month they have like these humongous fights.
Oh, and they didn't know about this. Interesting.
Yeah, and so we start with, and even if they create a lot of fights at their work, or they're on the verge of, breaking a lot of relationships with their friends. So part of the treatment that I do is the awareness of these mood log, that you get to see how my moods are changing, and then become responsible for your mood. This is our body, so we are the only one who knows what's going on with it. So if I'm going through my PMS, it is my responsibility to tell my spouse and my friends, I'm a bit agitated right now. You don't even need to say I'm on my period or as my PMS. You just say, I'm not feeling very well. I need to take care of myself. I'm a little more sensitive these days. And then remove yourself from whatever it is that is agitating you. Take care of yourself, take massages, water, bath, anything that makes your body feel a little bit better, and then come back and connect again with others. Even if for a couple of days you need to isolate yourself in order not to have a lot of triggers coming from outside, respect yourself. And that's the part that I've watched people, when they know it, they're aware of it, they take care of themselves, they don't destroy their relationships that afterward they have to come back and apologize for that behavior. And for themselves to know that this is a normal part of who you are. Obviously, you can get treatment from hormonal treatment, but the other side of it is knowing that this is how your body operates. And those times, if there are major issues, the topics and the content of the issues may be similar throughout your life, but in these times they get extended or they get severe. So something that you could tolerate this week, you might not be able to tolerate. It also gives us a lot of clue in what we need to work on in therapy, where we can dismantle a lot of these issues because they're heightened, so we know what they are, and we can work through some of these issues in therapy where therefore they don't show up as much for the person.
Question for you, Doctor, to have you here. They say that men also have PMS. Is that something that you've seen? Because I don't treat men, but I've heard about it. Do you have any idea about this? They say that they have mood swing, they get upset. What do you feel about that?
Well, PMS means that you are getting your mood swing due to hormonal variances. So do men also have hormonal variances? Of course, they also do. But it's not necessarily every month the same way as a female is. So usually if they are irritated, it is important to see what it is that they're irritated about. What is it that triggers them? Is it part of their personality or shows up in cycles? And then if it only shows up in cycles, then we need to look at different versions.
I see. Okay. So the main thing is that, I guess, if there's something that triggers the anxiety, triggers the stress, triggers the mood swing, you stay away from those triggers. Maybe go to your room, maybe stay away from that person or that environment, and that way probably you will do better in general.
Very much, and then pamper yourself. Some people pamper through exercising. Some people pamper through doing yoga or just sleeping a lot more or resting or getting massages or any of those. Allow yourself to pamper your body and not push too much out of it because it's too sensitive. And you move yourself away when it's sensitive. You can imagine if you have a bruise here, right? And you know this is sensitive. What do? You cover it, you allow it to heal. If somebody's coming close to it, you go like this. Imagine that week. That's what's going on with your whole system. That's how you take care of yourself.
True. Sounds good. Great information. Thank you very much, Doctor.
It's been great with you.
Great to see you again. Bye-bye.